All right, Dr. Emer, we are live.
Hey guys, it's Dr. Emer, and I'm really excited to be here with one of my clients who's having her first time treatment on her chest. And you know how many women really start to get early discoloration, sun damage, wrinkles, and a little bit of redness? We call that poikiloderma on the neck, which is sun damage that occurs early in life with red and brown discoloration. The best treatment in the past has a car wash effect to kind of clean the skin, make it more bright every 3 to 4 months, was BBL. But we have the newest device here called BBL Hero. This literally can treat this area in seconds, and I'll show you in a second how quickly it flashes. Take a look. Fast pulsing. Hero is high energy, rapid output. Now I have made a combination treatment of BBL plus what we call Moxify. Moxify is our new non-ablative laser. You see this called Moxie. It can be used on every single skin type, and it's great for resurfacing wrinkles, improving texture and color. And so we're gonna use this on top of the BBL on her chest, and then our AERIFY kit is gonna be placed as our EMERAGESKIN AERIFY kit. It's gonna be placed on immediately afterwards and left on for about 8 hours. She'll wash after that and use the skincare products inside, plus my refit base, to get an amazing transformation of this area in just a few short days, although the kit lasts 2 weeks. So again, let me show you the BBL. I'm gonna do a pulse so you can feel it first. 1, 2, 3. How do you feel?
No, I felt nothing.
Nothing. It's amazing, because in the past, BBLs and light therapies were really painful. They also were really high risk for Asian skin type and just mixed ethnicities. The risk of developing hyperpigmentation, or what we call striping, was really high. And so what we're gonna do is just do a few passes of this low fluence, high pulse light therapy to just basically wash away pigmentation and redness. And we're gonna do just a few passes at our both skin tightening and sort of red-brown discoloration setting. Then we're gonna add one short pass of a different filter that focuses on brown discoloration. So you guys can see, so quick, just a little bit of heat that builds up, minimum. How do you feel?
Oh, I feel the warm.
A little bit. Now I'm gonna switch over to my 515 filter. Nothing really strong, just a low single. We're gonna do like a 1 or 2 putt pass, pulsing. We take a look at the skin, everything looks phenomenal. I don't see any issues. So again, this is our BBL Hero. It's gonna bring out any of the red, brown discoloration. We're treating the chest area, you guys. This is an area like a lot of people used to neglect, but then their faces looked amazing because they treated that area and nowhere else, but they looked old because of the discoloration they had in their chest. So we're treating this early for her, so she gets a lot of improvement and sees perfect. So that's the BBL portion. What questions do they have on that?
All right, someone is asking, what is this treatment that we're doing today?
Yeah, this is called the, you can tell in the first part.
All right, so this is called Moxify plus BBL. We are using our BBL, which is our broadband light lit right here. This is gonna treat the color.
Perfect, and this was Hero specifically, which is the newest, most advanced BBL or light therapy on the market today. High energy, rapid output. You guys can see already some of the red discoloration is already being brought up from the focused filters. Now we're gonna go to Moxie. So we did sort of the deeper vascularity, the sun damage. I just need a regular goggle here.
Is this the same as with IPL?
That is actually IPL is sort of the older school type, but yes, it's light therapy. So now I'm gonna do the chest area resurfacing. So I'm gonna measure, this is what's so cool about this device. It literally measures the area. And we're gonna go all the way across full chest. And it's literally measuring the device to tell us what strength we can go for her skin type. I'm not gonna go really crazy heavy the first treatment, and also the chest tends to take a little longer to heal. So we're gonna do just a lighter treatment in this area, and I'll take a look at how it does. I'm gonna get my goggles on for safety purposes, and here we go. So you're gonna hear, hold on. You're gonna hear it kind of popping. You hear that? Like kind of popping noise? That's like little holes that are being created in the skin that you can't even see. Can you give her a fan, please? How does it feel?
Feels like a little, kind of like a little stinging and pricks.
Exactly. So it's like a little bit stingy. We're gonna give you a fan to hold on there. Why did you want to do this treatment? Like, what was the interest?
Because I've noticed in the past few years just more redness in my chest that I know is from sun damage from my earlier days. And just like I've noticed wrinkles too, like when I wake up.
Got it.
Sleeping.
Exactly.
Yeah, and I was like, I wanted to do something before it got worse.
And it's like treating the face. I mean, you have to be we call it prejuvenation. You have to start treating before it occurs, because if you wait too long, then it's so much more difficult to improve. And this is such a wide area, but the cool thing about the 1927 wavelength, which is what Moxie is, it really focuses on the upper surface. So everything you just said, the discoloration, fine wrinkles, early redness, that's literally all sun damage. And so this will resurface the sun damage. The BBL went at a different depth, a little deeper, to kind of clean that area. Now we're resurfacing the area, meaning it's gonna peel lightly. So you're gonna have these little dots here. You're doing great.
And how many treatments, like, usually would you do?
Yeah, I mean, I usually tell people the first two should be kind of spaced closer together, and you see how much improvement you get from that. Once somebody sees like a nice improvement, usually it's about 2 treatments, 4 to 8 weeks apart. Then you go every 3 to 4 months. Now, Moxie, I've been doing alone, even on my face monthly or every 2 months. It's very, I mean, it really can make your skin look amazing, but it's up to you if you want to look red for 2 or 3 days post-treatment, and do that more frequently. Some people do, and some don't.
I was asking, is this similar to Clear and Brilliant?
So this is actually different than Clear and Brilliant. Clear and Brilliant's a diode, 1440, Permea, a little bit different wavelength, but this has a little bit more energy. So this is closer to a Fraxel, stronger than a Clear and Brilliant. You can go as light as a Clear and Brilliant, a little less than a Fraxel. So you have the ability to kind of be very diverse with the treatment. But yes, in terms of non-ablative laser, low downtime, resurfacing, low energy, low density, that is one of the competitors. But again, this is the newest technology, you guys. Things advance. And Moxie's quite amazing. I mean, look at, she has minimal pain. We could treat her Asian skin type quite easily. This is gonna be a great prejuvenation treatment for her. It's gonna treat a wide area for her. We're almost done, actually, with the treatment. And then what we're gonna do is my sort of pioneer treatment, which is to combine my AERIFY mask, my AERIFY illuminating mask, our complexion revival system, immediately on afterwards, which has in it retinol, TCA, salicylic acid, niacinamide, which is an amazing brightening vitamin, kojic acid, and vitamin C, all things you need to improve skin quality. And then it has in it, the kit has products that will help you heal. We're also adding our Refit Face, which is our #1 growth factor and peptide serum. She's gonna use that twice a day with the kit to help it heal. Now the chest takes a little longer to heal than the face, so this normally would be like a couple days. The chest may have a couple more dots on it for a short period of time, but clear up pretty quickly. And it's very important to use good skincare after so that you actually get the exfoliation and you see the improvement. One more pass, we're almost there.
Right. Someone's asking, what other areas can you use this on? Face,
Face.
eyes, neck?
Oh yeah, all of them. Face, eyes, neck, chest. People do elbows and knees. Anywhere you might have sun damage, wrinkles, discoloration. This is a lighter treatment with less downtime.
Why does the chest take longer than the face?
You know, the face has less hair. The face has more hair follicles. So the chest in women, especially since there's less hair follicles, unless you're super hairy, tends to take a little bit more time. And I'll take a look, you guys. Look at those dots. So that's what non-ablative lasers do. They have these little dots. You see, that's all dermal heating, microscopic thermal zones. So now I'm going to open, so that's going to create the channels that are going to allow our product to get into the skin. And this, all this kind of like sea of yellow sort of dots coalescing, that's swelling. That's normal. We're going to use cold air, which is what she's doing right now. Hold on, let's turn that up a bit fast. Now we have our EMERAGESKIN AERIFY kit. This is something I designed, you guys, to go on pre and post laser. You can do it every 2 to 4 weeks at home to boost your skin quality. It has in it our growth factor and vitamin C botanical serum, our retinol with hyaluronic acid called Hyla A, a great sunscreen, a BB cream here with vitamin C in it, and our #1 foaming polish, which has jojoba extract in it. It's a water-based cleanser. Everyone loves it. So now we're going to apply the mask, which I described before. Has all the brightening agents in there and the exfoliation agents, and niacinamide, arbutin, and vitamin C will help her heal. So you guys open this really quick if you can get it. And then we're just gonna literally apply it on here, and she's gonna leave it on for about 8 hours. So I'm gonna show you guys. Just gonna apply a thin film. It might be a little cool across this area. And we're gonna massage it in. And I love applying AERIFY right after treatment because in the old days, everyone told me I was crazy combining treatments, but the results that we're getting are absolutely phenomenal. And it's safe for all skin types, and she's gonna get like a boosted result. It's almost like getting 2 in 1. So I'm gonna rub this in, which is nice and cooling actually, post laser. And as long as it stays on for the 8 to 10 hours, we will be good, and then she'll start her skincare regimen. So that's it. You can see the AERIFY mask has a yellow color, and that's basically cooling. And now she's gonna cool on her skin. I'm gonna show you again. I want her to actually answer a little bit. How did that feel? What was your expectation of treatment?
I thought it was gonna be, because this is my first laser. Like,
Oh really?
Yeah.
I feel so lucky.
I thought it was gonna be like a lot more intense. But yeah. It was,
And that's the cool thing, because you actually did an intense treatment. But because it's such a new age technology, this BBL Hero, literally fast pulsing, high energy, almost no pain, right? You barely felt anything in the first treatment. Then we did Moxie. You can see it worked. I mean, you guys can see the swelling. You'll see on video later. You can see the dots. Look at this right here, okay? But she didn't have much pain at all. And now we're doing the most advanced treatment, combining skincare to get absorbed into these microscopic thermal zones, so she gets more brightening, more tightening, and quicker healing. And again, that's going to include vitamin A and growth factors. Right now, the mask that's on, our AERIFY illuminating mask, you can see the yellow discoloration is a little bit of retinol, vitamin C, niacinamide, TCA, lactic acid, salicylic acid. That's going to help her get improvement more quickly. So that's really it, you guys. Moxify plus BBL Hero. What questions or anything do you want to ask? What else should we let people know?
And this is a mid-level treatment.
Yeah, this is like, I did about a medium strength. I don't want to see how you heal in the first treatment. If everything does really well, we can go a little bit stronger. The black box, the refit. I want to see how you do. Always when you start out, you don't want to overdo the first treatment. So this is about mid-level. You should see a result in the first treatment. You'll notice. And then yeah, I mean, you can alter the Moxie's power by downtime. So here's a couple days of sort of healing. We're going to add Refit Face, which is my growth factor serum. You guys can see how beautiful the bottle, obviously amazing, but what's inside is an unbelievable growth factor, multiple growth factors and peptides that will help this heal. So she's going to add this on twice a day, and this will last her through the couple weeks of her AERIFY mask using the EMERAGESKIN Refit Face. You can get emeragecosmetics.com, but we recommend all our clients to use this after. So that's really it. I'm really excited with her skin type. You have to be more careful and ensure that you don't do too strong and get discoloration, which is why we're doing proper skincare and sun protection, and we're using the newest technology. So again, Moxify is BBL Hero. Stay tuned to see amazing results coming soon. All right, so now that's it.